Health Network.
Hi, and welcome back to A Healthy Balance. I'm Jenny Souter. Our discussion on hysterectomies and their alternatives continues with the addition of our next guest. Dr. Stephanie Saramides is the director of the Women's Health Program at the Mount Sinai Medical Center in New York City. To join our discussion on hysterectomies, give us a call at 1-800-664-3258 or email us at thehealthnetwork.com. Dr. Saramides, thank you so much also for joining us and adding to our discussion today. I was reading some information from you earlier and learned that women can have hemophilia.
Women can indeed have bleeding disorders. In most cases, we wouldn't call them hemophilia as the classic case in men. The disorder in women is most commonly something called von Willebrand disease. It is a disorder that affects about 1% of the American population. And therefore, for example, in a typical family practice with about 2,000 patients, there'll be 20 to 30 patients with von Willebrand disease.
Is this something that you test your patients for, any bleeding disorders?
No, we don't. We test them for everything else but that, but probably after this show I'm probably going to reconsider that.
Yeah. What are some of the symptoms of bleeding disorders?
The female has actually several reasons to bleed more commonly than the male. We have monthly periods, so heavy menstrual bleeding is a very common symptom of bleeding disorder. Pregnancy and delivery of babies also presents an enormous stress to the bleeding system, to the coagulation system. And bleeding at the time of delivery is a very common symptom. Nosebleeds, heavy bruising, bleeding when brushing teeth are also very common presentations.
Do these bleeding disorders ever get mistaken for something else that then may wrongfully lead to a hysterectomy?
Sure. The consideration of bleeding disorders isn't, as Dr. Junco discussed, very high on the list.
Well, how do you test for them? How do you diagnose?
It's actually the most important test, if you will, is to talk to the patient, something that's a lost art, unfortunately, these days. To take a very good history, for the person who has the issue to tell the doctor that this has been a problem for a long time, that I have nosebleeds, that I have bruising, to actually get that information.
So something as simple as bruising or bleeding, I know I bruise every time I just bump up against a table, could in fact be an indicator of a bleeding disorder.
That's absolutely
very
right.
interesting.
That's absolutely right.
Teresa is on the phone joining us. Do you have a question for us?
Yes, ma'am.
Hi, welcome to our show.
Hi. I've been having pelvic pain and a lot of bleeding, and I've been doing this about a year. And I went to a doctor, and they couldn't really find nothing wrong with me, so I went back last week, and they gave me an exam, and I had an enlarged uterus, and I was bleeding heavy then, so I got to go back this week to get a ultrasound done, and from there, they'll take it from there.
From your perspectives, let's talk to Teresa, each of you, Dr. Saramides, starting with you. What suggestions would you have for Teresa?
I would say, Teresa, please make sure that you give the doctor a very good history of the bleeding. How long has it been going on? Has it been going on since your very first period, or is this something new? Are there any other bleeding issues? Do you have nosebleeds? Anything else going on? Anything in terms of medication that might be contributing to bleeding as well?
Are there specific tests that they could run to check for that as well? Physical tests?
Yes. The blood tests the initial ones are very simple. They include a blood count and an account of the cell called platelets that are involved in preventing bleeding, and some screening tests for bleeding, which are very easily obtained and relatively inexpensive, at least as a first order of business.
Okay, and any doctor would be familiar with all of these. Yes. Dr. Del Junco.
Teresa, there's a couple of diseases, and I'm going to have you probably look at my website to get some information, because there's a lot of information on there, and it's www.alternativesurgery.com. There are multiple reasons outside from just fibroid tumors that can cause some of this pain and bleeding, and one of those being that of adenomyosis, which is endometriosis of the muscle of the uterus. And that in itself is, when they do ultrasounds, they will notice an enlarged uterus in most cases, but in some cases the uterus may be just slightly enlarged, but they can have tremendous changes in their menstrual period associated with cramps
so
and bleeding.
So there are several different things that this bleeding could be symptomatic of.
Yeah.
Elsie's on the line. Elsie, do you have a question for our doctors today?
Yes, my name is Elsie. Let's just know I'm kind of a little nervous, but I had a hysterectomy 9 years ago, and I guess now from listening everything that you've said there and that the doctors have said, I realize now that I didn't get enough information. I was put on Premarin, and I've been on it until 2 months ago. I started weaning myself off of it for the reason that I know there's good effects for it and there's also bad effects for it. I just want an alternative to take instead of medications. I tried 3 years later. I didn't try. I wanted to have a child 3 years after my hysterectomy and found out, you know, it was just too late for that.
Is there an alternative for Elsie?
Well, if Elsie, if you're taking Premarin and you're having problems with that, and a lot of women do post-hysterectomy, I developed a natural hormone replacement, which is a natural formula of estrogen replacement. And a lot of women do better on that formula. It's
Again,
the
something
dosage.
she could find on your website and read up on?
Yes, she can get our 800 number from our website, and
Right.
she can call us and we can order it for her.
Thank you for that call, Elsie, and good luck. Up next, the discussion on hysterectomy alternatives will get even more lively when we're joined by the Health Network's own Dr. Walt Laramoy. More today, you're watching A Healthy Balance, and we're talking about hysterectomies.